So I just give a quick overview of where we are in our trainings and learnings. Some of this have been shared by Peter in his presentation. So I'll just quick skip over some of this. As you know, we have our 10 the training of trainers, the bioethics, the confident Christianity, and the various things. We can see that there. This current generation, that the 8th generation, we had almost 30 trainings happening. You see the numbers here. I just want to highlight a couple of things. We usually get about, if you get 100 people joining, 60 complete, 40 drop out, or 55, 45. So almost 40% do not finish. As of now, we have about 500 people going through trainings, just getting over. And almost 4,000 people have been trained over the last 4 years. And God has been so good. Something which started without even we thinking, planning, God used. So watch out for this new programs that are coming up. In the last 6 months, what we have done is we have been asking each other, what are the needs around us? So these few topics have been told to us. So our field workers are getting together and creating these new training programs, LGBTQ, climate change and health, caring for caregivers, practical issues of life for the young people, and salt and diet in the industry. Watch out for this arrangement, this announcement. One new thing we want to start is on mentoring. Anybody who's interested to help us to put together, please reach out to me. The other thing, like Peter said, one of the major developments in the last 6 months have been getting this huge 15 people to take the burden and take the burden of the trainings ahead, and the passion. They're all passionate about those field, each of those areas. So you've got this friends who are taking each of those, the confident Christianity, the Sydenham, the servant leadership, the bioethics in each of those regions. So they are taking care of all those. So which means that I've got much lesser work to do in terms of coordinating this. And of course, the 29 saline trainers who works behind the 4 training administrators. There is David, Diana, Mary, and Bhaskar. We have 2 new people who are doing the family medicine and the translation and the healthcare management. As you heard from Peter, we have had this amazing journey of family medicine over the last 5 years. You see this map of the world. People are from 52 countries. Large numbers are from actually Southeast Asia and Africa. If you look at the colors that show the number of people per country, the darkest is 21, that is Nigeria and Cambodia, but Cambodia is about 19. The lightest might be Australia and some other country. So the middle would be about 8 to 10 people per country. This is the spread of our candidates. Currently, these are numbers here. And as Peter said, we are now about 50% through translating the family medicine into French, Spanish, and Russian. We need a lot of prayer and a lot of work to retranslate, counter-check it, and see that it is ready to roll out by January to March in the first quarter. And each of these locations we need, regions we need administrators and academic teams and contact centers. So the last couple of months and the next couple of months will be quite actively looking for, and we'll be reaching out to each of you to help us in doing that. We are putting together a similar one on postgrad diploma in family medicine and a hospital and healthcare management. We are writing the modules, about 28 writers globally, and about 18 global reviewers are reviewing it. We need more writers, more reviewers, and case studies. So if from any of your regions, if you're interested to help, so that there are people interested to contribute, just let me know. We have now moved into another technology, so I'll talk about it later. So we hope that in the next 6 months, we'll be able to set up self-learning programs in our website. Peter talked about the webinars. We are almost 200 plus now every week. And interestingly, webinars can also become regionalized now. South Asia has webinars, the Russian, that decentralization and more people are getting impacted. Technology-wise, we are trying to move from Slack to slacking on our Slack engagement to Moodle. Moodle is the 3 reasons why we are doing it is because in Moodle, we can keep all the resources with ourselves. It will not go off. Slack takes it off. And once you put up the resources, the whole modules, all the whole courses can be reused time and time again. So we are now piloting with about 4 courses. Most likely in the next 6 months, we will slowly try to move it. It's in the learning curve for many of us, but I think we will reach there. One of the things I want to leave with you is and encourage each of you to develop and adapt trainings relevant for your local context. None of these training programs are cast in stone. Please feel free to develop, adapt, or let us know what you want. We can journey with you and help you in whatever language we have to do that. I didn't talk about DMM in that because DMM, you will hear more about DMM from Nurgul in this day. So that's all from my side. Any questions you can put in the chat. I'll be available to respond or help. Thank you.
Thanks, Santhosh. It's amazing to see the slides and the detail of numbers. Those numbers speaks for themselves. As someone has said, numbers don't lie.